We can usually fit in urgent scans on the same day, but if you're wanting a particular time, it's wise to phone up a few days or a week or so in advance. Yes, I do clinics morning, afternoon and evening. Evening clinics we hold on a Monday, Wednesday, Thursday and Friday. I do a scan clinic on Saturday afternoons between 1 and 5 p.m. I do all my own scans. I'm a consultant in fetal medicine with over 25 years experience. I don't delegate the scans to any juniors or technicians. They're all done by myself. The scan that you'll have will be appropriate for the gestation, the stage of pregnancy you're at, because I do the full medical scan appropriate for that stage of pregnancy, as well as of course trying to get decent photographs and what have you for you to take away. 3 and 4D scans we can do at any scan after 11 weeks of pregnancy. The actual diagnostic or medical component of the scan is always done in 2D, but then I make best efforts as I possibly can to obtain reasonable 3 and 4D pictures for the parents to take away with them. Scan appointments are usually half an hour. That includes time to take the history from the patient so I understand that what's happened in the past and what's been going on in this pregnancy, time to do the actual scan, which after the early stage scans beyond 11 weeks, then we're always scanning for a minimum of 10 minutes and longer if it takes longer to get the necessary information. And then I spend time interpreting the measurements, going through my report with the parents, and they leave with a printed copy of their report. Unfortunately does occur. What I'll do then is sit down with the parents at the end of the scan, explain in detail exactly what's wrong, discuss with them what further investigations can be done and what their options are, and we can then arrange for those investigations either to be done privately or I can refer them back into the NHS for further investigations to be done there. We used to do amniocentesis and CVS, but that's now largely been replaced by non-invasive prenatal testing, the Harmony test, and we do that here. It usually takes 7 or 8 days for the results to come back, although on occasions it can be as quick as 3 days. We can't assess the gender below 11 weeks of pregnancy, and I generally wouldn't recommend it in the 11th week because the accuracy really isn't very good. Once we get up to the upper end of the 12th into the 13th week, you're looking at 80 to 95% accuracy, and that gradually gets more accurate until once you get to 15-16 weeks when the genitals are fully formed, you're looking at about 99.9% accuracy.